Welcome to BioVerseInfo, your trusted source for medical and paramedical education updates. If you want to build a successful career in healthcare, you're at the right place. Diploma in Occupational Therapy, full course details and information. Here's a detailed overview of a diploma in occupational therapy, what it typically involves, how to get in, what you'll study, potential career paths, and things to check, with a focus that can help if you're looking at doing this in Pakistan or similar education systems. If you like, I can also check specific colleges in Lahore, Pakistan that offer it. What is it? A Diploma in Occupational Therapy, OT, is a focused, vocational level program designed to train you in helping people with physical, cognitive, emotional, or developmental challenges to participate in occupations, i.e., meaningful daily activities, and improve their quality of life. The field of OT covers rehabilitation, therapy, adaptation of activities, work with children, the elderly, etc. Typical details, duration, level, entry requirements. Here are what many institutions follow, though local Pakistani colleges may differ. Duration, often 2 to 3 years of full-time study. For example, one institution lists a 3-year program with 2 semesters each year. NICE.gov.s level, diploma level, less than a full bachelor's degree. So you'll likely work under supervision rather than be a fully independent OT immediately. Entry requirements, usually completion of secondary, school 10+2 or equivalent, often with science, biology background is preferred. For example, candidates must have completed their secondary education or its equivalent, typically 10+2. A background in science subjects such as biology may be preferred, Sunrise University in. Some institutions may allow mature students or those with relevant work experience. NICE.gov.sc mode, usually full-time, with both classroom theory, plus practical fieldwork components. Typical. Syllabus, what you'll learn. While details vary by institution, here's a broad breakdown of modules, topics you'll likely come across. Year 1. Fundamentals, Introduction to Occupational Therapy. History. Principles, what OTs do. Sunrise University Din. Anatomy and Physiology. Understanding Human Body Systems. Musculoskeletal. Nervous, sensory, relevant to OT. Basic Medical Sciences. Pathology, Pharmacology Basics. Medical conditions affecting everyday function. Sunrise University in Psychosocial Aspects, Mental Health, Development across Lifespan, Sociology, Psychology, Introduction to OT Skills, Activities of Daily Living, ADL, Adaptive Equipment, Basic Assessment, Sunrise University.in Year 2, Specializations and Practicals, OT in Pediatric Settings, Children, Adult Adolescent Geriatric Settings, Rehabilitation and Physical Disabilities, Therapeutic Exercises, Mobility Aids, Assistive Technology, OT in Mental Health, Psychosocial Interventions, Therapy Techniques for Mental Disorders. Requirements you'll find. Completion of secondary schooling in science stream, e.g., physics, chemistry, biology, or equivalent. Example, in Bangladesh, SSC Science with Physics and Chemistry for Diploma in OT. Behapia Edobadi, minimum score percentage in qualifying exam, e.g., one site, 60% in math for national exams. English language competency may be required, especially where medium is English. Some mature entry options, e.g., work experience in health-related field may allow admission. Curriculum, subjects. The subjects typically cover basic sciences, anatomy and physiology, neuroanatomy, musculoskeletal system, microbiology, etc. Core OT subjects, models of occupational performance, therapeutic skills, infants, children, adults, geriatrics, physical dysfunctions, mental health therapy, assistive technologies, social behavioral sciences, psychology, sociology, communication, ICT, research, leadership, professional ethics. Example, in Malaysia Diploma Program, learning objectives include ICT, entrepreneurship ethics, faculty UCMI edu.my, practical clinical work or work-based experience, WBE, e.g., attachments at hospitals, special schools, elderly homes. Practical clinical placement. A crucial part, students will undergo work attachments, internships, clinical rotations in settings like hospitals, medical, surgical, orthopedic, neurology, pediatric units, mental health, community health, elderly care. Example, for the 3-year diploma site, work-based experience, WBE, support or implement therapeutic activities, adaptive equipment usage, community rehabilitation, work under supervision of an occupational therapist in hospitals, rehab centers, special schools, community health or elderly homes. Example, the diploma. Program states graduates will be employed as a qualified occupational therapy technician under supervision in medical, surgical, orthopedic, geriatric, special school settings. Possibly continue further studies. Some programs indicate that diploma graduates may proceed to a bachelor's or bridging route. Career opportunities, pediatric OT, adult rehab, geriatrics, mental health, community OT, assistive technology, workplace ergonomics, depending on setting. Scope, career prospects. The field of occupational therapy is growing globally because of aging populations, increased awareness of disability, community rehabilitation models, inclusive education, and assistive technologies. Since you are in Lahore, Pakistan, these are important items to verify. Recognition and accreditation. Ensure the institute and program are recognized by relevant professional regulatory bodies in Pakistan, e.g., Allied Health Regulatory Body, University affiliation. If you do the diploma abroad, check local acceptability, qualification level and scope. Ask whether the diploma is considered technician assistant or full therapist. Ask what jobs alumni of the program in Pakistan are getting. Entry requirements locally, many listings show. FSC, pre-medical with minimum marks, or equivalent science qualification. Confirm for the specific institute. Duration and curriculum. Make sure it is 2 to 3 years and includes core OT subjects plus clinical attachments. Be wary of shortened programs without enough clinical exposure. Practical clinical placements. How many hours in what settings? Hospital, community, special schools, supervised by qualified OTs. Career support and placement. Does the institute assist with job placement? Internships, networks? Pathway to higher studies. If you later want to upgrade, bachelor's. Does the diploma allow credit transfer or bridging? Job market. Salary data in Pakistan. What are typical roles for diploma graduates? What are starting salaries and growth potential? Fees and cost benefit. Compare tuition, fees versus expected job outcomes. Ensure you're making an informed investment. Language of instruction, especially if the medium is English. Ensure you are comfortable. Institute infrastructure and faculty, labs, therapy equipment, access to clinical settings, qualified lecturers, scope of practice. Understand legal, regulatory limits of what a diploma holder can do, e.g., are you restricted from independent practice? From certain settings, from getting licensed? Example, typical detailed specification based on a reference program. Here is what one realistic program lists to give you an idea of full detail. Based on a 3-year diploma program from one site, nihas.gov.se. Duration, 3 years, 2 semesters per year, each semester towards 21 weeks. Entry requirements. For example, S5 level and mature applicants. International. IGCSE or equivalent with grade C or better in English, second language. Biology and chemistry. National exams, 60% or better in mathematics. Also, work experience route for mature applicants, 3 years health-related. Core courses, examples. Anatomy and physiology. Communication. ICT. Information, communication, and technology. Psychology. Sociology. Microbiology. Infection prevention and control. Health promotion and education. Leadership and management. Research. Legal and ethical framework. Neuroanatomy. Musculoskeletal system. Occupational therapy media. Models of occupational performance. Early childhood development. Occupational therapy practices with infants and children.
Why it's a good choice. You'll be working in a meaningful role, helping individuals regain independence, improve quality of life. It's a healthcare allied profession, so there is demand. Offers hands-on practical work which can be rewarding. Good stepping stone. You could later pursue further study, bachelor's, certification, to expand your scope. Some things to consider, especially in Pakistan. *** recognition and accreditation ***. Make sure the institution and the diploma program are recognized by relevant health or education authorities in Pakistan, for example by the Provincial Health Department, or relevant occupational therapy or regulation body, so your qualification is valid for employment. ***Scope ***. In some countries, the diploma might not allow full, independent practice as a qualified OT. You may need further study to become a fully registered occupational therapist. Fieldwork clinical training ***. Ensure there is robust practical clinical component, real work placements, exposure to diverse settings. Upgrade path ***. Check whether the diploma allows you to later upgrade to a bachelor's in OT, if you wish to. Admission criteria ***. Check specific criteria for the college in Pakistan, minimum marks, required science subjects, etc. Employability in Pakistan ***. Research how in Pakistan the job market is for diploma holders in OT, hospitals, rehab centers, special schools, etc. Cost and duration. Understand tuition fees. Duration, some may be shorter than ideal. And what is included? Lab access, equipment, placements. Curriculum relevance ***. Make sure the curriculum covers both physical and psychosocial aspects and is up to date with modern OT practices, assistive technology, community-based rehab, etc. If you like, I can look up a list of colleges in Lahore, Punjab, Pakistan ***, that currently offer a * diploma in occupational therapy * with fee structure, entry criteria, and send you 2 to 3 good options. Thanks for watching. Don't forget to like, share, and subscribe to BioVerseInfo, your trusted source for medical and paramedical course details. Stay connected, stay informed, and keep learning with us. BioVerseInfo, education that heals.